Heah Sheau. I'm the pediatric dermatologist from Sunway Medical Center and Sunway Specialist Center, Damansara. So today we're going to talk about infective skin disorders in children. As we all know, infection happens very commonly in childhood. So one of the first line immune defense system of our body is our skin. That's our first line. So when this first line defense is broken, you get infection first into the skin, and potentially it can cause more damage internally. So let's start with the most common ones. I'm sure a lot of people have the experience of getting a trauma or a cut somewhere, and then the first thing that you do is wash it and keep it clean. Why are we doing that? Because we don't want infection to set in. So that's the thing. When you have your first line defense broken, you actually invite infections to come in, and germs are everywhere. So the common skin infections in children, we have different types according to the different pathogens. First of all, most commonly we have bacterial infections. That's what happens when you have a cut or a fall and you have pus formation in your wounds, or what we call nana. Well, that is actually an end result of your immune system fighting with the bacteria. So you get all this pus formation. So the second more common one is viral infection. Commonly we see things like viral infection, like a viral wart, very commonly, and a molluscum contagiosum, a type of pox virus which happens very commonly in childhood. And then we see chicken pox, hand, foot, mouth diseases, which is very common in Malaysia as well. Then we have fungal infection, which is a very slow infection. Now it usually starts with places which is warm and moist, for example the armpit, the groin area, where you have scaly, dry skin with a bit of itchiness to start with, but it goes very slowly. Then we have things like parasitic infections. The most common is our scabies, or we call it kulis buta. Now this kind of scabies infection is quite common in crowded, congested places, for example like the asrama penuh. So these can cause very itchy skin conditions, and it can be quite widespread in the whole family. So always look at the child, whether this child is having an infection, fever, unwell, not taking orally well, or if there is a pus formation, swelling, redness, and pain and tenderness. Bring your child to see a doctor for more faster treatment and management. So how do we prevent infection in childhood? Now when we talk about skin disorders, there are not many vaccines unfortunately to prevent skin infections, but the most important thing is hygiene and surveillance. For example, when you have a fall or a cut, always clean it and dress it properly, and if you need it or you need an antiseptic, you can use an antiseptic to prevent secondary skin infection. And if you have an underlying skin condition, for example an atopic eczema, which causes a lot of itchiness and dryness, you need to put your moisturizer and as according to what your doctors are telling you, so that you don't get a secondary bacterial infections. And also to diagnose and treat early any skin infection. For example, a viral infection like hand, foot, mouth disease or chicken pox, which just happened in the same nursery room, classroom, or even inside the family. Isolate the person so that it doesn't spread to the others. And most importantly, for personal hygiene, wash your hands frequently, okay, and be careful about cleanliness. For example, if you have a dirty environment, okay, you are more prone to getting infections. If you have undiagnosed and untreated family members with either skin infection which are very infectious and contagious, you will get it. So get treatment early. So to conclude, skin infections in children is almost unavoidable. It's part of growing up. But know when to refer to a doctor, know how to look at for the signs of a child who's having an infection, and be safe and clean.